Private hospitals, especially in Nairobi, are reporting having received an increased number of new COVID-19 patients. And what is even more concerning is that they are comprised of more severe cases. This is according to various facilities, which also warn that Kenya's third wave of COVID-19 infections is set to peak in the next month and a half. And Zainab Ismail reports on this concerning development in a country where senior government officials are in the forefront of providing great opportunities for the virus to spread, even among some of the most vulnerable.
On Sunday, the February 28th, the country recorded one of the highest COVID-19 positivity rate in recent weeks at 9.9%. The government's data shows a rise in infections in the last 2 weeks, and now experts are warning that the recent upward trend should be a cause for concern.
We've had a positivity rate of more than 5% for the majority of the days for the last 2 weeks, which is quite worrying considering that since December, the positivity rate was below 5% from end of December all the way towards the end of February. The more the number of people getting to hospitals with serious COVID, the more it is a reflection that the infection is out there in the community and is spreading.
In a memo dated the 26th of February, signed on behalf of the Chief Medical Director at the Nairobi West Hospital, Dr. Andrew Gashi, noted that both private and public hospitals were experiencing rising numbers of confirmed COVID-19 admissions with a worrisome number of severe cases. The memo also indicates that the country's third wave is expected in the next 4 to 6 weeks.
What we can hope is that this third wave will be a low peak. It won't be a massive surge, which is what we expect because more people have immunity in the community. And hospitals in Nairobi have actually raised the flag and sounded the alarm and are saying we are now admitting more patients into ICU. We are admitting more patients into our respiratory units. This is an actual indication that something is cooking.
In mid-January, experts from the Kenya Medical Research Institute had warned of a possible virus surge in March as a result of schools reopening and the December festive season. The projections show that in the most feasible scenario, the country is likely to record at least 116 more deaths by June 1st.
What we are seeing now is a result of all the laxity, the complacency, both among the citizenry, but also the people in authority. If you look at political rallies, nobody is wearing masks, and no leader is asking people to wear masks. Go to the mosques, people have stopped observing the 1 meter, 2 meter social distancing rule. You go to most of the churches, guys are crowding. Most homes, people are not really observing this thing. So we become complacent.
The Nairobi West Hospital's memo also shows that the virus is unpredictable as there are many variants, plus there is much to be learnt. It continues to say that what is known is that the third wave and the issue of herd immunity are intertwined with the behavior of the virus. The actual extent of the virus spread remains unknown to the public as private hospitals claim to be having a high number of infections and public hospitals not testing everyone. This as the country awaits the government's next communication on containment measures in 2 weeks when the extended 3-month nationwide night curfew elapses.